Navigating recovery after surgery often brings a lot of questions, especially about daily tasks like caring for your incision. You might wonder if you can manage everything yourself or if you will need a little help. It is completely normal to have these thoughts, and taking an active role in your healing journey is a sign of great self-care. Generally, yes, you can often change your surgical incision dressing alone, but this depends heavily on the specific type of surgery you had, the location of the incision, and your personal physical capabilities. Your surgeon or nursing team will provide very specific instructions tailored to your situation, and following these guidelines precisely is the most important step for a smooth recovery. The primary reason why self-dressing changes are sometimes discouraged or requiring assistance is to ensure proper sterile technique and to monitor the incision site for any early signs of complication. Reaching certain areas, like your back or the back of your leg, can be difficult or even impossible without help, leading to improper dressing application or accidental contamination. Furthermore, post-surgical pain and limited mobility can make even simple tasks challenging, which is why having an extra set of hands can be invaluable for both comfort and safety. To determine if you can manage alone, consider the location of your incision and your range of motion. If the incision is in an easily accessible area and you can comfortably reach it without straining, then self-dressing might be feasible. Always have all your supplies ready before you start, including clean gloves, sterile dressing materials, and any prescribed ointments. Wash your hands thoroughly with soap and water for at least 20 seconds before and after, even if you are wearing gloves, and work in a clean, well-lit space. If you feel any pain or discomfort, or if you cannot see the incision clearly, please ask for help. An important insight from medical professionals is the concept of a clean technique versus a sterile technique for home wound care. For many post-surgical incisions that are not considered open wounds, a clean technique, involving careful hand hygiene and clean, not necessarily sterile, gloves, is often sufficient at home. However, your medical team will specify if a more stringent sterile technique is required, which might involve sterile gloves and instruments, making professional assistance more critical. Always err on the side of caution and consult your care team if you are unsure. Empowering yourself with knowledge about proper wound care is key to a successful recovery, and being realistic about your physical limitations after surgery is a sign of strength, not weakness. Whether you manage your dressing changes independently or with assistance, prioritizing cleanliness, monitoring your incision for any changes, and adhering to your surgeon's instructions will significantly contribute to your optimal healing and best possible outcome.